Thank you for joining us for this webinar. Today, we'll explore lessons learned through a supply chain strengthening program for faith-based drug supply organizations in 3 countries, Cameroon, Ghana, and Nigeria. We're going to wait a couple more minutes while people join. Hi, everyone. Thanks for joining us. We'll get started in just a couple of minutes. Hi, everyone. Thanks for joining us. We're going to get started in 1 minute. Great. We're going to go ahead and get started. So thank you all for joining our discussion today on the important role that faith-based drug supply organizations play. You will see a slide with instructions in French to join the language interpretation channels. So you'll see down the bottom of your screen the little button for interpretation, and you can select French. So my name is Michael Fleming, and I'll be moderating the session today. Christian Connections for International Health, or CCIH, is grateful to host this webinar in its role as the faith engagement partner on USAID's Momentum Country and Global Leadership. Momentum is a 5-year program aimed at increasing the capacity of partner institutions and local organizations to deliver quality, evidence-based maternal, newborn, and child health services, voluntary family planning, and reproductive health care in USAID partner countries. So in today's webinar, we'll hear briefly from each of our speakers and then have time for questions. Please use the Q&A box on Zoom to type in your questions, and we'll answer as many as we can. If your questions are for a particular presenter, please indicate that along with the question. The webinar is being recorded and will be posted on the CCIH YouTube channel. Also, it'll be posted on the CCIH website at ccih.org under Events and Webinar Recordings. You'll get an email with the link to the recording after it's posted. So just briefly introducing myself, I'm Michael Fleming. I'm a senior expert in McKinsey's social sector and global public health practices. I work in 2 main areas. First, I support donors and multilateral agencies at the global level on topics of market shaping and procurement for health commodities. Then second, I support ministries of health and other country-based organizations to strengthen their domestic supply chains. I'm now going to give a little bit of background on the DSO activity before we hear from each of our speakers. So first of all, what is a DSO? You're going to hear that term a lot during the webinar. In Africa, some religious organizations, such as churches, provide healthcare services to their communities. A few of these organizations also provide a range of medicines and medical devices, sometimes just to their own clinics, but sometimes also to public sector clinics. And we call these organizations faith-based drug supply organizations, or in today's webinar, we'll just shorten that to DSOs. Now, the importance of faith-based or DSOs to the national public health system can be significant. In some cases, DSOs serve thousands of public health facilities in a country, although it's more common that they would serve tens or hundreds. Recognizing the importance of DSOs to national health systems, USAID's Momentum project partnered with a range of DSOs in Africa over 2 years. First, to help them assess the strength of their supply chains, and then to develop a capability building program targeting areas that needed strengthening. And the objective of this was to strengthen supply chains, particularly by strengthening the technical leadership and management skills of critical employees at each of the DSOs. Next slide, please. Across the program, the Momentum project team partnered with 8 different DSOs and across 5 countries during the program. Today, you'll be hearing from leaders at 3 of those DSOs, one each from Cameroon, Ghana, and Nigeria. We also had participation from DSOs in Uganda and Kenya. And you'll see the full 8 on the screen now. Next slide, please. So how was the program structured? Well, in year 1 of the program, the project team focused on supporting DSOs to conduct a self-assessment of their supply chain. For this, the Momentum project team adapted USAID's National Supply Chain Assessment Tool, or NSCA. The NSCA has 3 main parts. The first consists of mapping the supply chain. The second is measuring the maturity of supply chain processes. And the third is assessing the supply chain's current performance by looking at a range of key performance indicators. Throughout the evaluation, the team was able to help each DSO build a picture of maturity versus performance across all of the different functions of the supply chain. And you'll see kind of a typical output on the right-hand side of how each of the different areas of the supply chain could be mapped into one of these 4 quadrants. Next slide, please. Implementation of that assessment happened in late 2020. 4 main stages. First was an extensive planning process. So this was adapting the tool, planning which sites would be visited, and working to train the data collectors. Then the data collectors went out into the field and conducted a combination of virtual interviews and in-person visits to collect the data. The Momentum team worked with the DSO staff to analyze the data and to develop tailored reports for each DSO. Next slide, please. So across the DSOs, several functional areas emerged as common themes that needed strengthening. So we can't share a comprehensive list, and each DSO had its own strengths and areas for strengthening. But here you'll see a few examples of the types of areas that are identified for multiple DSOs as areas for capability building. And so these include things like overall consumption and stock data visibility, temperature monitoring, both from an equipment and a process standpoint, And then also things like delayed payments from customers within the area of financial sustainability. Next slide, please. The results of this year one assessment we used to develop a capability building program for year two. And that consisted of a set of online modules that were completed by many of the key staff at each of the DSO, particularly the central warehouse, but sometimes also including staff at clinics or hospitals or regional warehouses. And then second, what we call an in-field training session, where each DSO brought together their learning participants to tackle a problem in the central warehouse. Next slide, please. Looking at across the online modules, the Momentum team developed a set of 10 modules that targeted those 6 areas that we looked at earlier. And this included technical topics such as forecasting, shipments, fleet management, but also got into things like problem solving. So how do we go about addressing issues when they arise in a structured fashion? Next slide, please. And then lastly, that in-field training session allowed the trainees at each DSO to apply some of those learnings in a real-life situation. So each of the DSOs picked a particular challenge, which might have been looking at stockouts in one or more commodity groups, or looking at provision of adequate storage space in the central warehouse. Kind of each challenge was unique to one of the DSOs. And the project team at each DSO would come together, analyze the problem, and develop some potential solutions. So now that I've given you an overview of the program itself, I would love to let our presenters take things from here. So I'll introduce the first presenter. Next slide, please. So Fidelis Nyabango is a pharmacist trained in Nigeria at the Ahmadu Bello University in Kaduna State. He is a licensed pharmacist in Cameroon with over 14 years of practice, both as a full-time pharmacist and an international consultant. He worked as a chief pharmacist to the Presbyterian Church in Cameroon Health Services until June 2021, where he was appointed as director of the Presbyterian Church in Cameroon, PCC, Health Services. He has expertise in pharmaceutical supply chain management and is deeply involved in the fight against proliferation of counterfeit medicines across the world. Fidelis, over to you.
Thank you very much, and welcome to everybody to this webinar. As a brief introduction of the Presbyterian Church in Cameroon Health Services, we are located in Cameroon, and we have our health facilities in 5 out of the 10 regions of Cameroon, that is in the northwest, southwest, the littoral, and the western region. And we have plans to move up the northern part of Cameroon. Next slide. Next slide, please. Where we operate, we are both in the rural and in the urban areas. We have 4 general hospitals and 3 health complexes, 5 specialist eye hospitals, and 3 eye satellite clinics. We have 10 integrated health centers and 1 dispensary. The picture there is a typical example of one of our rural hospitals located in the rural areas of Cameroon, Achatugi Hills. Next slide. Next, yeah. Our DSO is called the Pcc Central Pharmacy. It was created to procure, store and distribute medical commodities to all Pcc health facilities mentioned above, and other private and government facilities. It has a compounding unit where we do local extemporaneous preparations. We have a quality control laboratory, which is based on the Global Pharma Health Fund mini-lab. We have warehouses, we have a logistic unit, finance department, and it is headed by a licensed pharmacist. Next slide. Next. On the lessons learned from the National supply chain assessment. Using the tools that were provided to do the self-assessment, we were able to identify several gaps in our supply chain. In our supply chain, for example, little was known as far as little was known as per financial management, both at the facility level and at the central level, and how it was affecting the supply chain of medical commodities. We had regular breach in the cold chain storage system, especially at the facility level, all due to constant interrupted electricity power supply. And we didn't see that as a problem, but it was actually affecting the supply chain. We had the regular breakdowns of delivery vans from the central store to the health facilities, causing drugs not to reach their destination on time. There was complete lack of a logical approach in tackling the challenges encountered at every level of the supply chain. So lessons that we learned after using the tool for self-assessment. Next slide. Next. See continuation of the lessons that we learned. We realized that there was limited space to store the needed stock, especially at the central warehouse. There was inadequate shelves to pack drugs, making warehouse management and especially inventory control difficult. You can look at the picture on the live, you see that's how the drugs were being packed. Cartons were packed up on cartons in our central warehouse. We had poor temperature and humidity monitoring system at the storage site of medicines and along the supply chain. Next slide. Next. From the supply chain leadership, the leadership training development program that we had a lot of lessons that we learned from it. The first one was that we tend to realize that supply chain management involves a multidisciplinary collection of professionals. For example, the drivers, the health personnel, the finance personnel, and administrative staff, they were all interwoven. They all needed to be, they all had a part to play in the supply chain for the supply chain to be successful and sustainable. Whereas that training on the different components of the supply chains with regular refresher courses for all staff working on the supply chain was essential for a smooth function of the supply chain. We also learned that in our case, we trained 50 staff members which came both from the central and the facility level. This led to all the workers working on the supply chain to speak the same language, the language of supply chain management. And this created a better understanding among themselves and led to a smooth functioning of our supply chain. Before, the finance were talking their own language, the pharmaceutical person talking their own language, the driver talking their own language. But now, after this training, they all had a common language, which is the language of supply chain. All the models in the supply chain training gave us an insight into the supply chain management and better equip our supply chain staff on their different responsibilities and how their respective actions affect the supply chain. Before, when you tell staff that do this, they don't see a reason why they have to do what you ask them to do. But after this training, everybody had a raison d'etre, as I put in French, had an understanding of why they were asked to do some certain things. Financial management, which we use as a standalone, we also realized that it was crucial to ensure a functional medicine supply chain system. Next slide. Next. The impact from the two programs. The first impact was that we realized the importance of warehouse training. We realized the importance of the warehouse training model and how it can be useful to improve our inventory management system. We have now trained staff who are working to improve our warehouse operations. If you can look at the warehouse on the picture now compared to what I showed before, there's a good improvement on how the warehouse needs to be arranged. We saw the need to decongest the central store by creating a bigger satellite store in another region with more improved stock management tools. And these tools were exposed to them from the leadership training. We now plan to build a new central store where more storage space will be available. And that will include, that's going to improve what? Proper warehouse management. Next slide. Next. See on the impact, our quality control lab, which was just limited to controlling the stock, to control the quality of the stock that was at a central store, has now moved from that function to what? To play the role of quality assurance across the entire supply chain, that monitor the quality of the drugs throughout the supply chain from the central drug store to the facility level. And this ensures quality standards are maintained throughout the supply chain. We have improvement in the availability of the right medicines in the right quantity, at the right time, and at the right place, and to the right facility. all due to improved functioning of our supply chain of medicines. Next slide. Next. Another impact from this leadership training was that we have incorporated into our training program now for pharmacy personnel in our training school some modules of this leadership training so that the students, by the time they graduate, they already understand the language of supply chain, and when they get into work, they will just flow along with the other staff that are already there. And we have budgeted refresher seminars for staff working along the supply chain from all levels, from level to facilities, so they can always come together and refresh themselves on aspects of these models and the impacts. Next slide. Next. In conclusion, and challenges that we are encountering to do the implementations of what we learn, the baseline assessment helped in identifying gaps which we originally did not see as a threat to our supply chain. The online training gave us knowledge on how to approach those problems and to logically find solutions to them. That is typically talking about the model of problem solving, the model of problem solving. Our biggest challenge is having the financial mobilization to address the problems identified and to implement the activities that can resolve them. I would like to end there. Thank you very much for listening.
Great. Fidelis, thanks so much for the presentation. We'll now move on to our next speaker, Dr. Paul Amo-Kaireme. Please remember, everyone in the audience, to post your questions in the Q&A box at any time for discussion after the presentations conclude. And if your questions are for a particular presenter, please indicate that along with the question. So Dr. Paul Amo-Kaireme is a Ghanaian and a passionate practitioner of public health and development. He holds a doctorate in public health and is pursuing another PhD in development administration in the Philippines. He is a co-director of Pcc Advanced Medical Center. He served as a hospital administrator, president of the Mid-North Ghana Conference, and adjunct lecturer in public health for the Adventist University of Africa in Kenya, and was the immediate past director of the Ghana Adventist Health Services. He recently accepted a position as the health director for the West Central Africa division of Seventh-day Adventist Church, based in Abidjan and operating in 22 countries. Over to you, Dr. Paul.
Thank you very much for the opportunity and also to be part of this Momentum project. Ghana Adventist Health Services, or the acronym GAS, is a faith-based organization in Ghana. Indeed, it is the third largest healthcare provider in Ghana. Ghana Health Service is number 1, Catholic Health Service is number 2, and Ghana Advent Health Services is number 3. We see thousands of patients throughout the country on the daily basis. Currently, GAS has 36 facilities across the country. And among the 36 facilities, 33 are clinics and hospitals, including our central medical stores, where we stock drugs and distribute them to the various facilities. We have a workforce over 5,000. The next slide. Let me quickly share with you our vision. Our vision is to win souls for Christ through holistic approach to healthcare, focusing on families, households, communities, and with a commitment to treat people with human dignity, respect, and as well as tolerance. So this is our mission. This is what we stand for. And our vision, the summary of the vision is to resource our facilities to provide quality healthcare to our clients so that they will feel at home when they come to us. The next slide. Let me share some of the lessons we learned from this project, Momentum Project. Indeed, this is a good project. We compared what we were doing in our facilities in the area of supply chain to the global standards. In fact, it is one of the parameters or the key performance indicators to what we were doing in our facilities. We noticed that what we were doing was far below the belt, which implies that there is a need for us to up our games to meet the international standards. With this quick background, let me share with you some of the key benefits Ghana Advent Health Services we derived from this project. Indeed, there was a tremendous improvement of computation of stock by facilities levels. This implies that we were able to ascertain the minimum, the maximum, reorder, and the emergency products which we need to procure or to work on. What should be the minimum order within the facilities and even at the central warehouse? What should be the maximum at the central warehouse and also in the facilities? And what are some of the emergency products which we have to give much credence to? This project helped us to establish all these things. We were also able to minimize stock out syndrome. In fact, previously we were struggling and there was a short out syndrome here and there, but this project helped us. And quickly, not only this, but also other products as well. As I have said already, now the facilities have become conscious of what to stock to prevent preventable stock outs. And also, facilities have adequate stocks all the time, and it has reduced stock out syndrome. Therefore, it is a plus to be part of this project for my facilities. And also, advanced adherence to basic supply chain standards were also looked into, and it was also a benefit for us. Now, all gas facilities operate in a uniform manner nationwide. Ordering of medications are the same within with a standard requisition form, meaning that all the facilities, we have one standard requisition form which they use to require or request for medication. In case those medications or products they've requested we don't have, then we issue a certificate of non-availability to them so that they can also look to other places to find them. The next slide. We were also able to identify some gaps, which has to do supply chain financing, supply chain relationship, information system in supply chain management. And also we are of the strongest opinion that it should be looked into at during the subsequent programs. And the project should be able to direct participants to where they can source for funding to mitigate challenges which are related to the project. The next slide. We were also able to establish that the cold chain protocols, there has been a strict adherence to a cold chain protocols in gas facilities to maintain quality, and basic cold chain equipment which were lacking are now available. We are trying as much as possible, and as a result of this product or this Momentum project, we've been able to look into it. And also another benefit has to do with effective financial management practices. The spending by our facilities has also been improved. In fact, some of the facilities were overspending, and now we've been able to ascertain that they shouldn't do that. As a result of this, now there is a strong checks and balances, and it has helped. It's as a result of this we've been able to secure some of the basics equipment and those stuff which we need to operate with. The next slide. With conclusion, amid financial constraints and availability of centralized technological information system to monitor stock at the various facilities by Gas Central Medical Stores, the implementation of the both programs have been highly successful. We are of the view that what we've learned and what we've been able to implement in our various facilities as a result of this program will take us very far. Thank you, and God bless you.
Great. Thanks so much, Dr. Paul, for the presentation. We're now going to move on to our final speaker, Jonathan Maniadoko. Please remember everyone to post your questions in the Q&A box at any time for discussion after the presentations conclude. And if your questions are for a particular presenter, please indicate that along with the question. So Jonathan Maniadoko is the Managing Director and CEO of Pcc Central Pharmacy Limited in Dsos, Nigeria. He's a pharmacist with experience in various settings, including hospital, community, production, and administration. He has 36 years of practice as a pharmacist, out of which he practiced in rural areas for 17 years. He also supervised the health department of the Jama'ah local government in Kaduna State for a year. He speaks at different fora on the safe use of medicines and healthy living. Over to you, Jonathan.
Thank you very much for this wonderful opportunity, and good day to all the participants. Pcc Central Pharmacy, ECPL, is a faith-based DSO that stands out for quality, products, and services, and we are trusted across the country. We manufacture and distribute medicines to government and private health institutions, in addition to faith-based health facilities that were established to meet their needs. We work mostly in North and Central Nigeria with a few distribution to the southern part of Nigeria. We facilitated the supply of family planning and maternal and child health commodities to faith-based organizations by the Plateau State government, but strictly within Plateau State. The central store we run supplies as many as 188 facilities, some are teaching hospitals, some are general hospitals, but majority of them are primary health care. The next slide, please. What are the lessons learned from the National Supply Chain Assessment? May I indicate that we assess 8 facilities, out of which we had a teaching hospital, a general hospital, 2 community pharmacy, a comprehensive health center, and then primary health care. And the essence was to discover the strength and weaknesses of those facilities. On forecasting and supply chain planning, it was discovered that it was based on consumption, and we discovered an accuracy of 50 to 85% in those facilities. We also discovered that distribution is challenged by poor road infrastructure, high fleet management costs, and the use of outsourced delivery services. Low storage space was common. Unreliable cold chain equipment was also noticed. Unqualified staff and limited temperature management tools is affecting warehousing and storage. Please, the next slide. We'll continue lessons learned. It is important we discover to have quality process in place and with an accredited laboratory for quality control testing. We also found that effective planning and sustainability are affected by inadequate documentation and low cash flow. We also found that limited number of skilled personnel and excess workload negatively affects human resources. The picture to the right of your screen is the team that did an assessment in Bingham University Teaching Hospital, owned by EQUA also. The next slide, please. Now we move to the second year, which is lessons learned from the Supply Chain Leadership Development Program. And the first lessons learned was how to solve problems. And we realized that solving problem actually requires strategic steps. And when that is done, the problem is understood better and the result yields great and lasting solution. On the supply chain processes, there are processes that add cost and effort should be done to actually knock them off. On quality assurance, we found out that it is essential not only to get feedback, but to receive them and ask for them. And we also discovered that forecasting is very important, so it needs to be accurate. We need to work on the lead time and also how to calculate reorder points to avoid stock out and expiration of essential products. We also, in the course of the training, discovered that teamwork improves productivity, it saves time, and increases income. To the left of your screen is solving the problems in the course of the infill process. Next slide, please. We continue. Now we'll look at what are the impacts in actually undergoing this training. Number one, we found out that problems are efficiently and easily resolved. Management stress is reduced. Effective use of time when carrying out warehouse operations. Organized and improved warehouse management. Increased level of team synergy, leading to better and more comprehensive results. Optimal management of time and resources to eliminate waste. Timely bulk purchases of medicines minimizes and reduce unneeded stocks. Next slide, please. Effective and sustainable record keeping. Effective and sustained quality check on medicines and services. And by the right, you can see a document drafted to check products when received. Significant feedback from customers was enjoyed after the training. Development and appropriate use of new standard operating procedure was developed. Training and retraining of staff regularly was embarked upon. Improved customer satisfaction was noticed. And the creation of the Office of Quality Assurance. We discovered that if we are to maintain and sustain lessons learned, we need someone to actually monitor and ensure compliance. And that was the reason the Office of the Quality Assurance was created. Next slide, please. Conclusion. The National Supply Chain Assessment Program was effective in identifying the strengths and gaps of the DSOs and prepared DSO staff for the Supply Chain Leadership Development Program training, which had tremendous impact on the services of the DSOs, especially Pcc Central Pharmacy. However, implementation is affected by the paucity of funds and poor implementation of some of the lessons learned by some service delivery points. Thank you so much, and God bless you all.
Great. Thanks very much, Jonathan. And so thanks to all the presenters. We're now going to open up to questions. For those in the audience, please put your questions in the Zoom Q&A box. And I'm going to start with a question for Fidelis. Fidelis, the question is, what are the new QA activities that were introduced in the supply chain after the training compared to before?
Thank you very much. Like I mentioned, our quality control lab moved from doing just quality control to doing quality assurance. Before, we were always centralizing in quality, testing the quality of products that we receive. But after the training, the Q&A activities that we introduced were, for example, we start doing supplier pre-qualification. We set up a team that goes out to qualify the suppliers from where drugs are gotten from to ensure that the good drugs get to the central, get into the supply chain. We started following up not only at the central level, but also at the facility level, the storage conditions of the drugs to ensure that standard storage conditions are met. For example, a drug like oxytocin, when it gets to the facility level, in the facility store, there's a fridge, but at the maternity where it is being used, there's no fridge. So when it's taken out from the facility store to the maternity, it is kept in the open. So we ensure that a small maternity or a cold box is kept at the maternity where oxytocin are stored. That's how we ensure that the storage conditions are met. We also put our quality controls lab now took up the quality assurance activity by ensuring that the cold chain during translation is maintained throughout until the point of delivery. For example, if a car that is carrying a cold chain along to go and deliver breaks down on the way, the quality control lab is highlighted immediately, and they follow up to ensure that the driver makes sure the ice in the blocks in the cold chain box are still cold. If not, arrangements are made so they can even buy ice from a nearby offline center stores beer to put into the cold chain box. That's how we do. Yeah. They will also ensure the medicines are handled at the facility level by point of dispensing, that the medicines are handled properly. There's a common mistake that the workers at the facility level do is that when they pull out a tin of medicines, the first thing they remove from it to throw away is a silica gel that is inside. But actually, that is supposed to be the last thing that should leave that box of medicine. So we ensure that that silica gel is not removed and thrown immediately the box is open, but it stays with the tablets inside that container until the last tablet is dispensed out. Those are the quality assurance modalities that we started implementing. There are many more, but I cannot mention all of them here.
Yeah. Thank you, Fidelis. That's a good sample. Jonathan, Dr. Paul also wanted to ask you about quality because we'd had a couple of questions here. Can you speak, like one of you to speak about how do you qualify your suppliers, and what do you do in terms of expanding quality control procedures that might go beyond just requiring a certificate of analysis from your suppliers?
Thank you very much. When it comes to quality, we give much credence to it. We see to it that the products which we are receiving from the suppliers to the central medical stores, we check the expiry date very well, and also so that at least it should have longer period, minimum of, let's say, if possible, 2 years or more. And also we, depending on the product, and also as soon as we receive the medications, we dispatch them to the various facilities upon request. And we see to that where they will store the products, it is a quality or good place, the storage, everything is okay. In terms of cold chain, everything should meet the standards so that the efficacy of the product will not be compromised. Again, when it comes to quality, we see to it that the facilities will request what they would need in order not to overstock the products for them to expire or to get to near expiry. So these are some of the things we do. And also when it comes to keeping the products, we see to it that based on what we've learned from this momentum project, the international standards are being followed in order to protect quality. Thank you.
Thanks, Dr. Paul.
I will try to talk briefly about the pre-qualification of suppliers. There is a standard in our country for every supplier. So what we do, we demand for their documents initially. When we receive the documents, we assess, and then we go beyond that by inspecting through visitation of those facilities. And the essence of the visitation is to assure that quality is sustained, to also try to find out the source of their medicines, because the source is very important, especially in a country that you struggle with a lot of substandard products. So we verify their source, we verify their documentation. Sometimes we go out of our way to also check with the regulators to make sure that the documents they are supplying are standard and genuine.
Yeah. And
Can I add
Jonathan,
something?
oh, sorry, Fidelis, go ahead.
Yeah, at our own level, talking about quality and SOPs in place, we rely very, very much on our quality control laboratory, which is basically dependent on the mini lab. So irrespective of the certificate of analysis, any product that comes to a place that can be tested by the mini lab, we subject it to the mini lab procedures and verify. And there are instances where certificate of analysis from the manufacturer is saying good, but passing it through the mini lab, it fails. And I've done further investigations with MEDS, which is also part of this program, to ensure that our results are okay, and then we reject such product or we report it to authorities across. For supplier pre-qualification, we ensure that the suppliers to our central store are first of all accredited by the government. You must have an accreditation certificate given to you by the government that you are a qualified supplier. And then we also have a panel within our DSO that goes out to do our own supplier pre-qualification. We go there, visit the supplier, check their warehousing system, and make sure that they meet up the standards for warehousing. Temperatures are there, the temperature charts are filled, the coatings are in coatings, and that's how we do it. And then any manufacturer what has come to us in the past with a product that is bad from our quality control lab, we tend to blacklist that supplier. That's how we do pre-qualify suppliers.
Great.
Thank you.
Great. A question for any of our presenters. Did the assessment detect any issues with expired, damaged, or undispensable drugs and devices taking inventory space away from good inventory? Did any of you see issues with expired, damaged, or undispensable drugs?
Well, we found some, but they are limited, they are few. And you understand the basis of that. What we saw much was more of stock out. And because when the resources, the funds are not enough, the likelihood of overstocking will be minimized. So we found a few, and those few had to do perhaps lack of synergy between the store and the outlets. So perhaps they found something was cheap and felt they could buy and use. Unfortunately, the facilities didn't see the need to acquire them. Those were basically the reason for some of the stock outs. But because of the limited resources, the stock outs, the expired products or damage were limited.
Yeah. Fidelis, Dr. Paul, any observations?
Yes, thank you very much. There was a significant observation when it comes to expiring product. The reason was that before this project, the central medical stores will be sending the products to them, or that putting into consideration the requisitions which they brought. And as a result of this, some of their products were getting expired. But now, before a drug or a product will be sent to the facility, it is based on a requisition. And it has also helped the central medical store to do proper forecasting as to what should be procured from their suppliers. And it has significantly reduced expiring products and even near expiring products. Thank you.
Great. Got a question. Oh, sorry, Fidelis, did you have something to add?
Yeah, just to add that during our own assessment, the issue of expired drugs wasn't much a problem at the facility level, because we are instituting a system in place where expired drugs are sent back to the central store to ensure destruction properly from the facilities every end of the year. So as to reduce the burden of facilities handling expired drugs or expired drugs stay in the facility occupying space that could be occupied by a viable stock. So that wasn't typically a problem that we experienced, but more we realized expired drugs more at the central store. But the central store has a policy also that it destroys these expired drugs every year.
Yeah. Thanks. Some questions for Dr. Paul. Just 3 questions together. How many patients does GAS see annually? A second question was, does Ghana have an NHIS? And what is GAS's supply chain greatest challenge?
Yes.
Comment on those.
Thank you. Let me start from the bottom. Ghana, we are operating with the National Health Insurance System. And this National Health Insurance System has helped a lot, meaning that those who are marginalized and they cannot afford healthcare services are able to visit various hospitals and clinics when they are sick. As a result of this, a lot of people troop into our various hospitals throughout the country. Last year alone, the year 2021, GAS saw over 800,000 patients in a year. Over 800,000 patients in that year. So this is the response I can give to you.
Yeah, I think that helps emphasize just the big role that DSOs can play, even at the considered at national scale. And then Dr. Paul.
Thank you very much. It is okay.
Sorry, what do you consider to be GAS's greatest supply chain challenge?
Yes, when it comes to supply chain challenge, well, with regards to GAS, as I've already established in that presentation, what we were doing previously were not up to or doesn't meet the global standards. Central medical stores were not taking certain issues seriously when it comes to requisition, stocking products and distributing them to the facilities, and even giving much credence to the quality and those staff. But right after this project, the Momentum project, it drew the attention to the leadership that something is missing. Therefore, there is a need to up our games, to strengthen the cause in order to provide quality services to the people of Ghana and beyond. And as a result of this, we've seen a tremendous improvement in our services. And as one of the presenters was saying, now we've opened our eyes widely, checking the background, the sources, and also we have also given much attention to the expiring products. You see, when it comes to the expiring products, at times the products should be getting expired, near expiring, but the facilities who are keeping or storing them will not inform the central medical stores, and they'll be waiting for it to get expired. But as a result of this project, now there is a synergy, there is a communication intermittently, and it has helped to reduce some of these challenges. What I would say in a summary is that this Momentum project has indeed helped GAS central medical stores to be on our to up our games, and also to be on ourselves with the global standards. Thank you.
Thanks, Dr. Paul. I have a question regarding manufacturing. And Jonathan, we'll start with you. ECPL manufactures as well as procures pharmaceutical products.
Yes.
are there government policies and programs that support manufacturing? And would you recommend to other DSOs the value of having a manufacturing role in your market?
So far,
Yes, thank you very much. I don't know the answer I will give. It. Okay.
Oh,
Jonathan, continue.
Yeah.
Okay, thank you very much. With COVID-19, the government introduced a policy of assisting production outfit, what they call Central Bank Intervention Fund. And I'm glad to say Central Pharmacy applied, and we succeeded in securing the funds. We are in the process of getting it released. So, but apart from that, you don't have a direct committed government intervention to actually assist in production. Well, you will hear of government pronouncements, but they are not realistic. They are never executed. Yes, with regards to whether some DSOs can be involved in production, manufacturing or not, is capital intensive. It requires a lot of resources. Any DSO going into must be very ready for it. It requires a lot of money with a lot of regulations to meet because it has to do with life. And so, but if the DSO has the resources to go into, it's interesting to be involved in because you impact will rely substantially, not only in Nigeria, I'm sure the whole of Africa, on importation. So if any DSO can go into that, that can also help in the country. Like we employ about 60 manpower. It's not too much, but you can imagine without that, that would have been a minus two in terms of the employment rate.
Yeah, great. Thanks, Jonathan. I'm going to switch topics just because we're short on time. I wanted to get through a couple of other questions. One is, do DSOs accept donated medicines? And if so, how are donated versus purchased medicines handled?
Can I take on that?
Yeah, Fidelis, please.
Yeah, the answer to that is yes, we accept donated medicines. And our policy at the Pcc Central Pharmacy is freely we receive, freely we give. As we receive it freely, we also distribute it freely to our facilities. At some point in time, we may tax a little fare for donations that do not come along with funding for logistic distribution. We may tax a little fare to support the distribution of the products.
Yeah. Thanks,
Okay,
Fidelis.
for us, the policy is, it depends on the donor. Sometimes the donors will donate to help the DSO to raise a little money. So what we do is we'll sell, but at a minimal cost, cheaper than similar products in the market, because that is the donor's contribution to the organization. But where the donor wants it to be given free.
Thank you very much.
We do that.
Okay.
It's okay. Go ahead, Paul.
Thank you very much, Jonathan. At our end also here, we receive such donations, but Ghana Standard Board of Food and Drug Authority will also do their background as to where the products are coming from. And then when we receive them as faith-based organization, we mostly give them the products to provide free or medical missions to the needed communities around us, and also those who don't have the purchasing power visiting our facilities. So we receive. For the past 3 years, we've been receiving such donated items in the form of drugs from US, India, and other places. And it has been beneficial to our people. As I speak with you right now, there is a team from US who have visited us, United Service to Africa, to perform surgical procedures and to give free treatment and others to people in our communities or catchment areas. Before they will end the project, they will perform over 500 surgical procedures, and they will see several thousands of people. Last year, when they came, they performed about 1,200 surgical procedures. Thank you very much.
Great. And we'll take one last question, and this is for all of you, but it's just, have you continued to be in touch with each other and any of the other DSOs that participated in the activity after the momentum support ended? And are there improvement ideas that you borrowed from each other?
In Cameroon, we are lucky that we had 2 DSOs that were involved. So those 2 of us in Cameroon are in constant contact, but we have not been able to contact any other DSO out of Cameroon. But one of our suggestions to the organizers was that they should create a platform where we could have continuous exchange of challenges as we move on.
Yeah.
Okay, we are also 2, unfortunately, in the same state, Plateau State in Nigeria. That is Chan Medifam. We've exchanged some thoughts, but not so much.
Right.
Thank you very much. I've learned a lot, even from today's presentation, from other presenters, Fidelis and Jonathan. GAS, Central Medical Stores, we should be able to intensify the background checks when it comes to procurement and those stuff. And also, I think we need, and if possible, on the more lighter note, it should be must, so that all of us will be on the one network in order to share ideas and experiences together. And even at a point in time, we can even visit ourselves to see what we are doing at our ends, and it will enhance what we will be doing in our various facilities, because knowledge sharing and knowledge borrowing is highly important. Thank you.
Thank you. So that concludes our webinar for today. Wanted to say thank you all for joining us, and a special thanks to our 3 presenters today.
Thank you so much also for the very rare opportunity. We appreciate it.
Thank you.
Thank you for the opportunity.
And sincere gratitude from the Presbyterian Church in Cameroon. Thank you to all the panelists. Thank you to all the participants, and thank you for the questions that actually bring out some of the good part of us. Thank you.
Thanks.
Fidelis, see you more.
Yeah, definitely. I'll cross to Nigeria.
Okay. Bye.